Welcome back to my channel. I'm Dr. Michael Morse, a licensed naturopathic doctor serving patients throughout Arizona. In our perimenopause series, we've broken down how hormones are your body's master communicators and explored the unique benefits of estrogen, both estradiol and estriol, progesterone, and testosterone for women in perimenopause. Before we dive into today's topic, a quick but important medical disclaimer. The information in this video is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard seeking professional medical advice or delay in seeking it because of something you've heard in this video. One of the most persistent and damaging myths about hormone replacement therapy is the concept of the estrogen window, or timing hypothesis. This idea suggested that hormone therapy was only safe or beneficial if started within a very narrow time frame, typically within the first 5 to 10 years after menopause starts. For years, this misinformation has instilled fear and prevented countless women from seeking the support they desperately needed. Many older women were told it was too late or too risky to start hormones. Let me be clear. This estrogen window theory has been largely debunked. Modern research and extensive real-world data show that women can safely and effectively initiate hormone therapy at any age, provided they receive a thorough health assessment and a personalized treatment plan. The key is individualization. If you're 60, 70, or even 80 and beyond, and you're suffering from symptoms that hormones could alleviate, the conversation is not closed. It simply means your practitioner needs to proceed with extra care, starting with very low doses and gradually titrating up while monitoring your health closely. Your age alone should never be a barrier to optimizing your quality of life. Another common concern, especially regarding topical hormone creams, is the fear of transfer, meaning will the hormones rub off on your partner, children, or pets? While it's a valid question, it's a largely non-issue with proper application. When applied correctly, hormones from creams are designed to absorb rapidly into your skin and then deeper into your body. Research shows that within about 5 minutes, the hormones are almost completely absorbed from the skin surface, meaning very little is left to transfer elsewhere. The key is proper application. Apply the cream to areas with some subcutaneous fat like the inner thighs or inner bicep area and rub it in thoroughly for about 60 seconds until it's absorbed. Then allow 5 minutes for it to fully penetrate before coming into close physical contact with others. It's also important to rotate the application site by every 4 days, rotating around from each inner arm to each inner thigh. This prevents buildup of the cream base, allowing for better absorption. The exception here can be vaginal preparations. Because the mucous membranes of the vagina absorb hormones very efficiently and hold on to them a bit longer, there can be a slightly higher potential for transfer if immediate contact occurs. Your doctor can advise you on the best practices for this route if it's part of your plan. One of the most important discussions you'll have with your practitioner is about the delivery method for your hormone therapy. This isn't a one-size-fits-all decision, as different routes can have varying effects on your body, particularly when it comes to long-term health outcomes like breast health. For example, oral hormones, like pills, are processed through your liver first. For some hormones and for certain individuals, this first pass through the liver can alter their metabolic pathways. Recent large-scale studies have shown that while estrogen monotherapy, or estrogen alone, can be quite protective for breast health when taken orally, certain combinations of oral estrogen and synthetic progestins may increase breast cancer risk for some women. However, it's important to note that oral estrogen alone still shows overall benefits for longevity and heart health. It can also come as a transdermal cream or gel or patches. Applying hormones to the skin bypasses the liver's first pass, increasing their bioavailability. This method is often preferred for maintaining more stable blood levels of hormones and may offer a more favorable safety profile, particularly for breast health when using combination therapies. Studies suggest that when a progestogen is needed alongside estrogen, a transdermal or vaginal delivery of the progestogen can significantly mitigate any potential breast cancer risks seen with oral synthetic progestins, which are distinct from natural progesterone preparations. It can also come as vaginal inserts or creams. These deliver hormones directly to the vaginal tissues for local benefits, but can also be absorbed systemically. This route is excellent for addressing vaginal dryness, discomfort with intercourse, and even bladder pain syndromes. It can also contribute to overall systemic hormone levels with a potentially very favorable risk profile, especially for breast tissue. The best method for you depends on your individual health history, risk factors, symptoms, and specific hormone needs. This is where personalized care becomes essential. So what are your next steps if you're ready to explore hormone therapy? It begins with finding the right healthcare provider. Number 1, seek a hormone-literate practitioner. Look for a healthcare provider who specializes in hormone therapy, functional medicine, or holistic care. Naturopathic doctors, like myself, are trained to look at your entire health picture and understand the intricate dance of your hormones. Number 2, comprehensive testing. Insist on thorough lab testing. This goes beyond just basic hormone levels. We need to look at specific estrogen types, your progesterone and testosterone, and crucial markers like FSH and LH, and sex hormone binding globulin, or SHBG. These provide a complete picture of your hormonal landscape and how your body is utilizing hormones. Number 3, personalized plan. Your journey should be unique. A skilled practitioner will craft a plan tailored to your symptoms, your lab results, your health history, and your comfort level with different delivery methods and hormone types. It's a shared decision-making process. And lastly, number 4, ongoing monitoring. Hormone therapy is not just a set-it-and-forget-it solution. Regular follow-up appointments and lab testing are essential to ensure accurate dosing, continued safety, and optimal wellness. The era of fear and blanket restrictions around hormone therapy is thankfully fading. We now have robust data and a deeper understanding that empowers us to use hormones strategically and safely to enhance quality of life and promote longevity. You don't have to simply endure perimenopause. With the right information and the right support, you can reclaim your energy, sharpen your mind, boost your mood, and feel vibrant and thrive through this natural transition and beyond. If this series has helped you feel more informed and empowered, please give this video a thumbs up, subscribe to the channel for more evidence-based health insights, and share it with any woman who deserves to feel her best. Leave your questions and thoughts in the comments below. I love hearing from you. Remember, your health is your most valuable asset. I'm Dr. Michael Morris, a licensed naturopathic doctor, proudly serving patients throughout Arizona, and I'm dedicated to helping you learn to advocate for and achieve your optimal well-being.